In today's video, we will be covering the importance of running fecal tests on a regular basis and the different types of intestinal parasites that can wreak havoc on not just our pets' well-being, but also our own well-being. Dogs and cats inadvertently pick up intestinal parasites when they spend time outdoors digging through infected soil and accidentally getting into infected feces. Animals can also get intestinal parasites from their mother at birth, so dogs and cats may be infected with these parasites even when they have never been outside. Plus, some intestinal parasites and their eggs can live in the soil for up to 5 years, so they are definitely out there to call our pets their hosts. Something to be aware of is that intestinal parasites do not always cause clearly noticeable or significant clinical signs when they are causing discomfort for our pets. Moreover, we usually cannot see the intestinal parasites with their bare eyes in our dogs or cats' feces because intestinal parasites normally stay in the body, and the remnants of intestinal parasites are microscopic eggs, only a few millimeters long and easily dismissible. After all, not too many of us carefully look through our dogs or cats' feces after they've done their business, right? Last but not least, intestinal parasites can also be zoonotic, which means they are transmissible between animals and humans and thus can even harm pet owners, especially young children. So, what intestinal parasites does a fecal test check for? Roundworms are common parasites that actually feed on the food that animals have ingested. Therefore, roundworms cause malnourishment, vomiting, diarrhea, weight loss, a pot-bellied appearance, and a dull hair coat. Roundworms can affect humans, especially children, and adult roundworms are white and several inches long, kind of like thin spaghetti. Hookworms are parasites that feed on the blood of their host. They are about 2 millimeters long and almost impossible to see even when they leave the host body. Hookworms can affect humans, especially children, and they are called hookworms due to their hook-like mouthparts that allow them to attach to the intestinal wall and feed on blood. Hookworms cause intestinal inflammation, vomiting, diarrhea, weight loss, poor hair coat, anemia, which means low red blood cell count, skin irritation, and itching. Whipworms have a tapered end that resembles a whip, and they are about 5 to 6 millimeters in length. Whipworms are another type of common parasite that embed into the wall of the intestines and cause inflammation. Early stages of whipworm infection often have no clinical signs, but will eventually cause a dog to develop diarrhea, weight loss, poor hair coat, weakness, blood in the stool, and/or anemia. Tapeworms are common in dogs, and they can reach 30 centimeters in length and have segments called proglottids that are passed in the feces. These segments are about 12 millimeters long and look like moving grains of rice. Tapeworms can only be transmitted by fleas, so the best way to prevent is by keeping your dog or cat on preventatives. Clinical signs of tapeworms is usually minimal, such as itchiness around the anus and frequently licking the hind end. In puppies, clinical signs are more severe, including anemia, poor growth, and even blocked intestines. Giardia is a parasite that may or may not cause symptoms. Dogs with healthy immune systems can clear it from their body without showing any signs. Other dogs may have diarrhea, weight loss, abdominal pain, dull hair coat, decreased appetite, or vomiting. This parasite is contagious to humans and causes similar clinical signs. Coccidia is a parasite that can also cause no clinical signs in healthy adult dogs, but it does cause diarrhea, vomiting, failure to gain weight, poor hair coat, and lethargy in puppies or unhealthy adult dogs. Diagnosing intestinal parasites as early as possible allows veterinarians to properly treat and clear the parasites from the GI system before they become serious issues for a pet's health. In other words, regular, at least yearly, fecal tests enable us to discover intestinal parasites, which do not always cause obvious symptoms in our pets and are virtually undetectable by the human eye. It goes without saying that fecal tests are really important because they permit veterinarians to recommend appropriate treatments or medications to clear the intestinal parasites and to prevent zoonotic intestinal parasites from spreading to us, the pet owners, or children. If your pet has not gotten a fecal test within the past year, please give us a call.